I'm Dr. Daniel Men, a board-certified plastic surgeon. Today, I will present my unique skin rejuvenation treatment, the DermanRx. I was born and educated in Israel. I moved to the United States in 1973. I did my general surgery and plastic surgery residency at the University of Louisville, and I have been board certified since 1981. I'm in private practice in Boca Raton, Florida. I have records of tens of thousands of happy patients. When I have some free time, I love to paint and sculpt. I invented procedures, some of which are shown here. Okay, now that you know almost everything about me, I want to expose to you a very unique and very special, in some cases, life-changing skin rejuvenation treatment. I will concentrate in this part of our body defined as the face. The face is the most important part of our body, especially when we talk about the appearance and first impression. The face cannot be covered as other parts of the body. So if we agree on this, I will go on and proceed to common severe difficult diseases we see on a daily basis on our patients, friends, and relatives. These diseases, they cause people a lot of misery. I took it as my mission to help them. The first one is acne. Acne breakouts are prevalent in over 50% of the population. Acne is an inflammatory infectious disease of the sebaceous glands and hair follicles. The second is rosacea. It causes redness and possible irregularities. It occurs in over 15% of the population. Over 45 million people in this country are affected by it. The third is melasma, a skin disease that is seen with patchy and dark pigmentation on the face and body. It occurs in over 27% of the population in this country, about 80 million people. The fourth condition, which bothers almost everybody, is the aging skin and sun damage. The skin is seen as a pale, yellowish, waxy color and is made worse by pollution and environmental factors observed in the majority of the population in this country. Sun damage affects most of the people around the globe. The UV exposure causes severe problems as sunspots, wrinkles, uneven tones, and changes in the texture of the skin. All these conditions don't have, as far as I know, effective, non-invasive, long-term, affordable solutions. Let me show you some of the cases treated by me lately. The first patient has a severe case of acne. He's 37 years old businessman. He couldn't lead a normal life. Look at his close-up photo. You can see breakouts everywhere, in the forehead, mid-face, lower face. In addition, you can see some melasma. He actually had to stay at home sometimes. He tried various kinds of antibiotics that didn't work for him. Please look at his after photo. Only 1 week after treatment, all of it is gone. Listen to what he says.
Hi, I'm Steve Mancodi. I had a very severe case of cystic acne and rosacea when I came to Dr. Mann, and I had tried every other remedy in the book practically, but once I tried the DermanRx, everything seemed to clear up very nicely. I am going out again, I'm hanging out with my friends, and I'm no longer focusing on my acne.
Next is a younger Asian patient. His mid-face was badly affected with acne. You can see breakouts in the middle of the face, which was so severe that he had been advised to take Accutane to try to improve his skin. Accutane, as you know, has many negative side effects. Please look at his after photo. 2 weeks after the treatment, the acne is gone. Here's another patient in her late 20s that was depressed and had a very low self-esteem. Close up at the left face showing no breakouts. It was cleared by using the special formula, and all was achieved in a period of 2 weeks. Let's move over to rosacea. Rosacea can be very devastating. Patients can't cover it up even with heavy makeup or any other means. Rosacea can also become so severe that it is called neurogenic rosacea, where the blood vessels and nerves are also involved. Patients are devastated. They tried various medications and antibiotics, and there is no real solution for them. By using the DermaNRx treatment, the rosacea is practically gone.
Hi, my name is Randy Miller. I've had severe rosacea my whole life. It's interfered with me socially, with going out, being in social groups, and now since I've discovered DermaRx, my whole life has changed. I'm going out, I feel more beautiful inside as well as out, and it's an amazing product.
Here is her before and after again. Can you see the difference? Let's go to melasma. Melasma is quite upsetting to patients. You see brown pigmentation over the right face. Here are some before and after where you can see clearance of the brown spots. Listen to what she has to say.
My name is Sandra Cooper. I'm a patient of Dr. Daniel Mann. I suffered from a severe case of melasma, like mostly all of my adult life. I came to see Dr. Mann and I started using his product, the Dermal RX, and within 2 weeks my face was completely clear. Everybody was asking me what I did. Did I lose weight? Did I this? My face was completely clear, and I use it religiously, and none of the marks have ever come back. I want to thank Dr. Mann for coming out with this treatment, because for me it's been like a breakthrough with my life. I don't have to rely on all this heavy makeup to cover all these marks, and it's just been amazing. And the care after is so simple. Just apply the cream and you're done.
Here is a different situation. This patient came for a facelift. She had a successful facelift, but she is still suffering from melasma. In order to achieve an improved look, we treated her with DermaNRx. You can see the before and after. Here's the melasma close-up showing on the left face, and brown pigmentation where after the treatment you see great improvement of the melasma. Here is a patient who originally came for rhinoplasty, but she also had melasma covering most of her face. After successful rhinoplasty, we treated her melasma. Do you see the dramatic improvement? Melasma can be seen here in an older patient. Brown pigmentation over the right side of the nose and underneath the eye. She was treated with this special formula. Within a short time, she got rid of the melasma spot. Sun damage. Sun damage in aging skin can lead to more changes as we age. You can see here some fine lines, freckles, and precancerous skin. Here is a younger patient with fine lines, breakouts, and sun damage on her face. If she wouldn't treat her facial skin now, it will only get worse with time. Here is the before, where there has been quite a bit of melasma breakout and sun damage, and here it has cleared up. Here is an older patient with breakouts of sun damage and aging skin. Look at the severe damage and here the clearance with this formula. The sun damage can be quite severe in these patients. Another older patient with severe sun damage and aging skin who came for a facelift. After the facelift, she was treated for the sun damage as she had around her mouth and eyes, and within a very short time you could see the improvement to her face. Listen to what she has to say.
Hi, I'm Susan Parks Jones. I knew that I was getting a little tired looking, and I decided that I needed a refresher. When I got to his office, I knew that I had found my home and where I was going to have my work done.
One of my biggest rewards is when I can treat a colleague physician. Here's a physician who came to me because of the aging signs on her face and neck. I did a facelift and improved it with a skin treatment. You can see the improvement to her skin. Listen to what she says.
I followed Dr. Mann's advice to have the DermaNRx, and my skin looks amazing. My pores have virtually disappeared. My skin is radiant and bright. It's the color is even. The dark spots have disappeared, and I just look very beautiful. Finding Dr. Mann has been a real blessing in my life because he is an artist. He knows exactly what I needed. He has the details and the eye of not only a surgeon but an artist. And he combines different procedures in order to get the best outcome. I want to thank you, Dr. Mann, from the bottom of my heart for the individual care, for your kindness, for your attention, and the love that I feel from your entire staff.
I presented you with several patients out of hundreds that I treated who were treated for acne, rosacea, melasma, aging skin, and sun damage. I'm actually showing you a new wide spectrum effective to almost every type of skin available. Combines light, medium, and deep peel, having the advantages without the disadvantages. I worked on this for about 6 years and developed an ultimate formula for both office and home treatment that takes only a couple of minutes to perform, and all of it is done as an outpatient with no downtime and no pain. Here is the treatment. The patient comes to the physician's office. We take before pictures, we explain to the patient how it works, and we make sure that the patient has the right expectation. We apply the first office treatment, they go home and take with them the maintenance package and the instructions. 8 hours later, the patient washes her face and applies a pea size of the home formula twice a day for the next 2 weeks. At the end of 2 weeks, they come back to the physician's office for a second and a final application. You can see the procedure. First, we clean the face with Gessner solution, then we apply the formula on the entire face. The patient will be instructed when to wash their face and to use the maintenance product as instructed. So what have you seen here? This is an innovative skin rejuvenation, unique formula that combines the advantages of light, medium, and deep peel with amazing results. It is fast and easy, no downtime, very affordable, with no pain, and the patients are extremely happy. Join my affiliation program to gain hundreds of patients that are very happy for many years. Thank you.